Healthy bladder and bowel habits are essential for a happy pelvic area. Your pelvic organs are all very closely related, so that if one area isn't happy, it will have an impact on the other areas. Two main things you can do to help look after your bladder is ensuring correct fluid intake. This simply means drinking the right amount for you, and avoiding any potential bladder irritants. How much we put into our bladder will have an impact on how it behaves. It's important to drink enough fluid. For most adults, this is usually close to 2 litres, and that should be consumed gradually throughout the course of the day. When we are well hydrated, our urine is of a pale, straw-like colour and of good volume. Not drinking enough will cause our urine to become dark and concentrated. This can irritate the lining of the bladder, making it want to empty more frequently. It's equally important not to drink too much fluid, as this too can upset the bladder by overfilling it, which means it has to work harder and empty more frequently. What we put into our bladder will have a direct impact on how it behaves. The caffeine found in coffee, tea, chocolate, or energy drinks can cause the muscle of the bladder wall to contract. Certain drinks can irritate the lining of the bladder. These are things like your fizzy drinks, alcohol, or anything acidic such as lemon, orange, pineapple, or blackcurrant squashes. Going to the toilet just in case usually means emptying your bladder before it is full. This sends mixed messages to your brain, which decreases your bladder's ability to store urine over time. That is what then causes worsening symptoms of urgency and frequency. If you would like to find out more about this, please watch our bladder retraining video by clicking the link in the description box below. It's important to fully relax your pelvic floor muscles in order for your bladder to be able to empty fully and in one go. Sitting down will help you relax those muscles, which is why we very much encourage you to sit down to empty your bladder. It is normal to empty your bowel between 3 times a week or 3 times a day. Your stool should be soft, well-formed and easy to pass. The most likely time for a bowel movement is around 30 minutes after your first meal of the day. So set aside some time after breakfast for an undisturbed visit to the toilet. It's important to avoid constipation, as repeated straining will lead to weakening of the muscles that help control your bladder and bowel. You should do this by eating a well-balanced diet with good fibre intake. You can increase your fibre intake by aiming for at least 5 portions of fresh fruit and vegetables, whole wheat pasta, wholemeal bread, whole grain rice, seeds and oats. Make sure that you are drinking enough. For the average adult, this is usually close to 2 litres. Most of what you're drinking should be water, and ideally you should limit your intake of caffeine, alcohol and fizzy drinks. Exercising regularly can help with constipation. According to guidelines, you should be aiming for 30 minutes of moderate exercise over 5 days a week. Avoid skipping meals, as this can make your gut sluggish and contribute to constipation. It's also important not to deliberately put off opening your bowels. You should go as soon as you have the first urge to go. Speak to your GP or pharmacist if you have ongoing issues with constipation. The position you are in can significantly help you to empty your bowels more effectively and avoid the need to strain. Sit fully on the seat and do not hover. Put your feet on a small footstool or a couple of books so that your knees are higher than your hips. Lean forwards, putting your elbows on your knees. Relax your tummy muscles so that they bulge outwards and straighten your back. Breathe normally. Do not hold your breath or strain. If you are still finding it difficult to pass, do not strain. Just try again later. It's really important to try and break bad bladder and bowel habits in order to keep your pelvic area happy. These tips will help keep your bladder and bowel healthy. If you have any problems or notice a change to your normal bowel habits, please speak to your GP. If you have any difficulties controlling your bladder or bowel, please speak to your GP or midwife for a referral to the Pelvic Health Physiotherapy team so that we can assess and treat your individual needs.